If you've woken up with numb fingers, or noticed a tingling that comes and goes throughout the day, your body might be sending you a message. And after 50, that message is worth actually listening to. Numbness in the fingers isn't just getting older. It's a signal, and depending on the pattern, it can point to 5 very different things happening inside your body, some simple, some that genuinely need a doctor's attention. By the end of this video, you'll know exactly what the different patterns of numbness usually mean, and which ones you should never ignore. Stick around for number 3. It's the cause most people never think to check. If you're over 50 or you're watching this for a parent or someone you love, this one's for you. After 50, nerve and circulation changes become far more common, and numb fingers is one of the most frequently dismissed symptoms out there. People assume it's just sleeping funny for years, when sometimes it's something worth actually addressing. So let's go through the 5 most common causes, one at a time, starting with the most common. Cause 1, carpal tunnel syndrome. The most common cause by far is carpal tunnel syndrome, pressure on the median nerve as it passes through a narrow tunnel in your wrist. It typically affects the thumb, index, and middle fingers, and it's especially common in people who spend a lot of time typing, gardening, knitting, or doing repetitive hand movements. Numbness that's worse at night or first thing in the morning is a classic sign. The encouraging news is that carpal tunnel is very manageable. In its early stages, wrist splints, stretches, and taking breaks from repetitive motions often help a lot. But if it's ignored for years, the nerve compression can become more serious. That's cause number 1. But the second cause is 1. A lot of people don't connect to their fingers at all. Cause 2. Neck and spine issues. Here's one that surprises people. Numbness in your fingers doesn't always start in your hand. Sometimes it starts in your neck. As we age, the discs and joints in the cervical spine. The neck can wear down, sometimes pressing on nerve roots that travel all the way down the arm into the fingers. This is called cervical radiculopathy, and it often comes with neck stiffness or a dull ache in the shoulder blade that people don't think to connect to their tingling fingers. The pattern here is usually different from carpal tunnel. It can affect different fingers, depending on which nerve root is involved, and it often comes and goes with certain neck positions, like looking down at a phone for too long. This is exactly why doctors ask so many questions before treating numbness, because the actual source might be nowhere near your hand. Cause 3, vitamin B12 deficiency. This is the one I mentioned at the start, the most overlooked cause of all. Vitamin B12 is essential for maintaining the protective coating around your nerves. After 50, your body naturally absorbs less B12 from food and certain common medications, like long-term use of acid reflux, medication, or metformin for diabetes, can lower B12 levels even further. When B12 runs low, one of the earliest warning signs is numbness or tingling that often starts in both hands and feet, not just one side. This one matters because it's easily tested with a simple blood test and easily corrected. But if it goes unaddressed for a long time, the nerve damage can become harder to reverse. It's one of the most fixable causes on this list, which is exactly why it's worth ruling out early. Now let's talk about a cause connected to blood sugar, because this one's becoming more common every year. Cause 4, diabetes and nerve damage. High blood sugar over time can damage small nerve fibers throughout the body, a condition called peripheral neuropathy. While it's more commonly associated with the feet, it absolutely can affect the fingers and hands too. Especially in longer-standing or poorly controlled diabetes, the pattern here tends to be gradual. A slow creep of numbness or a glove-like sensation, rather than a sudden onset. It often shows up symmetrically on both hands and tends to worsen slowly over months or years, rather than appearing overnight. If you have diabetes or prediabetes and you've noticed this pattern, it's genuinely worth flagging to your doctor. Catching nerve involvement early can help slow its progression significantly. And that brings us to the last cause, one that's more about your blood vessels than your nerves. Cause 5, circulation issues. The last common cause is reduced circulation, when blood flow to the fingers is restricted, whether from narrowed blood vessels, certain heart conditions, or a condition called Raynaud's, where fingers temporarily turn white or blue in response to cold or stress. This type of numbness often comes with a cold sensation or a color change in the fingers, and it can be more noticeable in cooler weather. Circulation-related numbness is worth paying attention to, especially if it's a new pattern after 50, because your blood vessels, like everything else, change with age and sometimes numbness is one of the first signals of that shift. The caveats. A quick but important note: this video is for general understanding, not a diagnosis. Only a doctor can tell you which of these is actually going on for you, often with a simple exam or blood test. That said, there are a few signs that should never be brushed off. Numbness that comes on suddenly, especially on just one side of the body. Numbness paired with confusion, slurred speech or facial drooping or numbness, paired with chest pain or shortness of breath. Those combinations need emergency attention right away, not a wait-and-see approach. For everything else, the slow, gradual, or activity-related numbness most people experience, it's absolutely worth mentioning to your doctor at your next visit, even if it seems minor. So carpal tunnel, neck and spine issues, B12 deficiency, diabetes-related nerve damage, and circulation issues. 5 very different causes, all showing up as the same symptom: numb fingers. If this helped you connect some dots, hit subscribe. Every week, I break down symptoms like this one, so you know what's worth watching and what's worth calling your doctor about. And let me know in the comments which pattern sounded most like what you've been experiencing. See you in the next one!